Welcome to Unit 3, Section 3, Treating Children's Illnesses and Injuries. Okay, after you go through this, you should be able to identify symptoms that reveal a need for prompt medical attention, explain why accurate measuring devices are essential in giving medications, describe first aid for treating wounds, burns, fractures, bruises and sprains, and splinters and bites and stings, identify common household poisonings and describe what parents and other adults should do if a child has been poisoned. List the steps to take for medical emergencies. Okay. Most adults who work with children will eventually care for an ill child. To treat a child's illness, adults must recognize the need for medical intervention. In some cases, children need to be taken to a medical professional for treatment. In other cases, parents can care for the children at home and treat them without assistance from medical professionals, often by giving medications and keeping children comfortable. Young children, especially those under 7 or 8 years of age, have many common illnesses such as cold and digestive upsets. Minor illnesses such as these are typically taken care of at home without seeking professional medical attention. Other minor illnesses, which parents can often handle at home, include mild fevers, anything that's under 101 degrees, diarrhea, a runny nose, and short-term vomiting. To safely treat children's illnesses, you must first be able to recognize symptoms that require medical intervention, sometimes immediate. For these illnesses, you should take children to a doctor or seek urgent care if appropriate. For minor illnesses being handled at home, treatment usually involves taking children's temperatures, preparing specific foods, and sometimes giving children medication. Keeping children comfortable, ensuring they get plenty of rest are also important. For many illnesses, children need medication to get well. Medications for children include both prescription medications, ones that are prescribed by a doctor, and over-the-counter medications, ones that can be bought without a prescription. Parents and other adults should always read instructions for medications before giving them to children. Some over-the-counter medicines, such as aspirin, should never be given to children. Any questions parents have about children's medications should be directed to a pharmacist or a children's doctor. Medications are best given in accurate, medically defined measuring devices. Incorrect dosages may deliver too little medication and hinder infections from clearing up. Too much medication may poison the child. Medications work best when they are given in ways that are easy for children to consume. For example, infants may suck medication through a nursing nipple with a ring attached, and some children may take medication from a dropper or syringe that doesn't have a needle in it, inserted far back at the side of the mouth. A pharmacist can advise parents how to give the medication so children receive the accurate dosages. Medications should be kept in child-resistant containers and disposed of properly, like through a pharmacy, a hospital, or trash service. Child-resistant caps need to be replaced carefully after use, and medications kept in an out-of-the-reach place, such as a locked cabinet. Medication should never be given in the dark, referred to as candy, or given in baby bottles or juice glasses, because that teaches children that it's candy or a treat and not important. Okay. Lastly, adults could avoid taking medication or even vitamins in front of young children because then they think it's a fun game, and keep medication away from children's reach, and they'll want to imitate you and take medicine too, even when they don't need it. Okay? When children are ill, they need extra attention. Infants and young children will need lots of holding and rocking. Older children may need their illnesses and the treatment explained to them. Most children who are ill also enjoy little surprises, like a small gift of a new book or a stuffed animal. Above all, adults can appear cheerful and confident so they will not cause ill children to worry. If the child's attitude is positive, this can help speed up their recovery. As children begin to feel well, they often do not want to stay in bed. Keeping an active child in bed at this time can be quite challenging for adults. Quiet games, books, movies, music, and paper and crayons can help children pass time. Visits from adults and other children, if the illness isn't contagious, can also help. Making a child comfortable can be especially important if the child is in a hospital. Adults can prepare children for hospital care by explaining hospital life, touring the hospital, and using play and other means to introduce hospital concepts. During the hospital stay, parents should stay with their children and, as much as possible, make the hospital feel like home. Right. In the case of severe illness or injury, adults may be required to administer first aid. First aid is emergency treatment for an illness or injury that is given before professional medical help arrives. Training in first aid can be very helpful to caregivers and is required as part of teacher training. First aid supplies, including a first aid chart or book, should be kept current and nearby. First aid includes guidelines for the treatment of wounds, burns, fractures, bruises and sprains, splinters, bites and stings, and poisonings. First aid also includes methods for dealing with emergency situations. Wounds are damages to the body's skin or tissue. Wounds may be caused by falls, punctures, collisions, and a variety of other accidents involving objects and other people. To properly treat wounds, adults should first identify the child's type of wound. Type of wounds include shallow cuts, abrasions, and deep cuts with heavy bleeding. For shallow cuts and abrasions, they can get them from falling, handling an object incorrectly, or running into objects. Cuts may bleed a little, but usually only damage the first layer of skin. If a child has a shallow cut that bleeds, first stop the bleeding by applying pressure using sterile gauze. After the bleeding has stopped, wash the wound using soap and warm water and apply an antiseptic, which is a substance that kills bacteria, to prevent infection. Cover the cut with an adhesive bandage or other dressing. If a child has an abrasion, which is called a scrape, follow the same guidelines. Make sure to wash the affected area carefully so particles do not remain in the wound and infect it. For deep cuts and bleeding, if they have a deep cut that has a lot of bleeding that will not stop, seek medical attention immediately. While waiting for medical help, try to stop the bleeding by applying pressure to the wound using a sterile dressing. Some children who experience lots of blood loss may go into shock, which is a condition in which the heartbeat and their breathing slow. If a child goes into shock while awaiting medical help, lay the child on his or her back and elevate their legs. Keep the child warm, like with a blanket, until medical help arrives. Back. For falls or collisions can cause fractures or sprains. With fractures, there are cracks or breaks in bones, and sprains are injuries to joint ligaments. Symptoms for both fractures and sprains include swelling and pain around the site of the injury. If a child experiences a fracture or sprain, seek medical help immediately. There is no way of knowing the severity of the injury without examination by a medical professional. If the injury occurs in the neck or spinal region, do not try to move the child. Rather, call for emergency medical help. Children who like to explore are prone to a number of injuries from their environment, including splinters, bites, and stings. Splinters are pieces of wood or plastic that become lodged in a child's skin. Shallow splinters can be removed with care using tweezers, but deep or large splinters should be removed by a medical professional. If a child is bitten or stung, check carefully for an allergic reaction. If the child is not allergic, wash the wound thoroughly to avoid infection. If a child is bitten by an animal, note the type of animal. Some animals can carry dangerous diseases like rabies. If a child is bitten by one of these animals, seek medical help immediately. Also, certain insect and animal bites are poisonous and require additional medical treatment too. Okay? For burns, children who experience burns are at risk for shock and infection. When treating a burn, you need to identify the degree of the burn. First-degree burns occur when heat or radiation burns the top layer of skin. First-degree burns include mild sunburns, where the skin turns pink but does not peel or blister. Second-degree burns affect the layer of skin beneath the first layer. Symptoms include blistering, peeling, discoloration, swelling, or severe pain in the skin. Finally, third-degree burns affect the innermost layer of skin and sometimes the muscle and bone beneath. Symptoms include blackened or whitened skin. The following are methods for treating burns. With first-degree burns, run cold water over the affected area for 15 to 20 minutes. Dry the area and keep it clean. Cover the burn with a clean dressing. For second-degree burns, do the same thing. Run cold water over the affected area for 15 to 20 minutes. Dry it, keep it clean. Cover it with a clean dressing. If it is large or deep, seek emergency medical attention immediately. For third-degree burns, seek medical attention immediately. Do not try to clean a severe burn. Observe the child for signs of shock and respond accordingly. So remember, elevate their legs, keep them warm, put them on their... Okay, so I want you guys to think, which injury are you least experienced in treating? And then think about what the right treatment for that type of injury is. Okay, so think about what injury you would be the least comfortable with treating if a child had while they were in your care, and then think about how you would treat it according to what we just talked about. All right, so poisonings. The majority of childhood poisonings can happen when children consume dangerous substances found around the house. Implementing safety measures around the home can help lessen the chance of children being poisoned. Reading all product labels and warnings can help parents identify which products are dangerous. Storing household products high above floor level rather than under sinks and locking up household products may help keep them away from children. Potentially dangerous products should not be left unattended or within reach even for a minute. Poisonings can be deadly to children. If a child has ingested a poison, you should take immediate action and call a hospital or poison control center. The person at the hospital or center will determine whether the child needs emergency medical attention. Symptoms of a poisoning might include fever, rash, choking or coughing, nausea, labored breathing, or irritation around the mouth or eyes. Right, so some common poisonous household products include cleaning products like air fresheners or ammonia, bleach, dishwasher or dishwashing products, disinfectant, drain opener, floor cleaner, furniture polish, laundry products, metal polish, oven cleaner, rust remover, toilet bowl cleaner, water softener. Garage and garden products include antifreeze, caustic lime, fertilizer, gasoline or kerosene, oils, paint, pesticides, putty, turpentine, varnish, weed killer, windshield solution. Some medications that are poisonous: acetaminophen, amphetamines, analgesic creams, antibiotics, anticonvulsants, antidepressants, antidiarrheals, blood pressure drugs, cold preparations, cough medications, diabetes drugs, ear medications, heart drugs, iron, vitamins with iron, nasal sprays, oil of wintergreen, pain relievers, sleeping pills, topical anesthetics, tranquilizers, and vitamins. And personal products: aftershave, baby and bath oils, cosmetics, deodorant, hair coloring products, hair removal products, hand sanitizers, lotion, mouthwash, nail polish and polish remover, perfume, permanent wave solution, powder, talcum, baby and body powder, water softener, rubbing alcohol, shampoo, and soap. All right, so sometimes adults will face emergency situations with children. Emergency situations are dangerous, often unexpected, or life-threatening events that require immediate action. Medical emergencies can arise from both illnesses and accidents. In a medical emergency, adults should always call for immediate medical help. When responding to emergency situations, adults need to know how to use choking maneuvers, such as cardiopulmonary resuscitation or CPR, and automatic external defibrillators or AEDs. Procedures for using these methods and devices can be found in your book if you're interested. Adults should continue first aid until professional help arrives and then not interfere with the assistance. The ARC and American Heart Association both offer first aid and CPR training so adults can become certified to effectively and safely treat children's injuries. Sometimes emergency situations occur due to fire, explosions, or weather. In these cases, adults or teachers should comfort children and follow the evacuation or safety plans that have been practiced. A caregiver or teacher could have a flashlight and first aid kit next to the evacuation doors or in a safe area for easy access while helping children remain safe. The ARC's first aid guides, available both in print and digital media formats, contain further pointers for preparing for emergencies. Adults should be trained to manage emergencies involving children. Most states have policies that require people working with young children to have training in dealing with medical emergencies. So if you're interested in working with children, you're going to have to learn how to deal with them in medical emergencies. All right, thank you guys. That is the end of Unit 3, Section 3.